Hello everyone, we have covered hip joint biomechanics in previous video. So now we will see the knee joint biomechanics. It is a hinge variety of synovial joint and it is prone to various sports injuries. It provides stability and mobility. It is composed of mostly two distinct articulations, that is tibiofemoral joint and patellofemoral joint. Tibiofemoral joint, it is proximal to the knee joint. It is not included in a knee complex. It is not inside the knee capsule and plays a great role in ankle joint. So function of the knee joint is statically support the body's weight during the erect posture and dynamically responsible for the mobility. Here you can see the diagram where the distal part of femur and proximal part of tibia articulating with each other and forming a joint. Now we will see the tibiofemoral joint. So it is a condylar type of synovial joint and it provides 3 degrees of motion, that is flexion, extension, external and internal rotation, abduction and adduction. Articulating surfaces proximally femoral condyle and from distally tibia. The attachments, the menisci are present over the proximal surface of tibia. There are two menisci, lateral and medial, and they form the concavities in the femoral condyle to fit. It provides the joint congruency and distribution of weight uniformly. Here you can see the diagram of the menisci. The next is the joint capsule. It is the overlapping of a superficial fibrous layer and thin inner synovial membrane. It restricts the excessive joint motion and maintains the joint integrity and function. Now comes the ligaments, extracapsular and intracapsular. In extracapsular, patellar ligament and lateral and medial collateral ligament, which is present laterally and medially to the knee joint, and intracapsular ligament, there is anterior cruciate ligament and posterior cruciate ligament. Here is the diagram of the ligament. It is important to draw a diagram in exam for effective answer. So you can see from medially medial collateral ligament and from laterally lateral collateral ligament, and in anterior and posterior part anterior cruciate ligament and posterior cruciate ligament. Then the clinical abnormalities. This can be asked in a viva question also. When the tibiofemoral angle at a knee joint is greater than 185, then it is said to be abnormal and termed as genu valgus, and it is lesser than 175, then it is abnormal and called as genu varum. Remember according to the diagram so you will not get confused. Next comes the kinematics, in which the osteokinematics draw the chart according to the movement, plane, axis and range of motion. In movement, flexion, extension, abduction, adduction, medial and lateral rotation. Next is arthrokinematics, in which you have to write about the roll and glide movement of the knee joint. In this diagram you will see clearly the tibia is fixed. During the flexion there is a posterior glide and anterior roll, and during the extension there is an anterior roll and posterior glide. Thank you so much for watching the video. If you find it effective, then please give it a like, share and subscribe.